Good morning. This is Dr. Eng Ji Bah. First, I'd like to thank 𝗙𝗿𝗵𝗶𝗋 for inviting me to talk a little bit about my specialty. I qualified from University of Cambridge, England, and then trained in cardiothoracic surgery in England, and also in the United States, where I did fellowships in the Mayo Clinic and also the world famous Cleveland Clinic. Now, I've been practicing cardiothoracic surgery for over 20 years, especially in adult cardiac surgery. As we know, heart disease is the greatest killer anywhere in the world now, even in Asia and so on. So now, when confronted with severe heart disease, and in particular we're talking about coronary artery disease, where the arteries are blocked and so on. Now, there are two choices. Firstly, and most commonly, a lot of patients will go for angioplasty and stenting, so-called PCI, percutaneous coronary angio intervention. Now, the other treatment is heart bypass operation. When we talk about surgery, we normally refer to bypass operation. Now, over the years, as we become more experienced with these two methods, it has become quite evident that in patients with severe heart disease, that is, when more than two arteries are blocked, or especially if the main stem, the left main stem is blocked, the result of bypass surgery is much better when we look at following up for a few years, say 4 years and so on. And we're looking at the survival of people after the treatment. So a lot of studies have come up to show that bypass operation is better in terms of improving patients' survival. But of course, treatment is one thing. Isn't it much better to prevent getting heart disease in the first place? And this is where lifestyle changes comes in. Now, if you're smoking, then obviously that's a major factor. You should stop straight away. The other major factor is the diet. And I'm more than convinced now that the root cause of all these diseases, including heart disease, is our choice of diet. There are two steps in terms of healthy diet. In my view, the most important step is to avoid damaged polyunsaturated fat, right? So here we're talking about sunflower oil, corn oil, canola, and soya oil, especially margarine made from this oil. The second step is to reduce the amount of animal-based products. Then this would include meat, milk, and even egg. For more information, do contact 𝗙𝗿𝗵𝗶𝗋.com. Thank you.